Hello everyone, welcome to my video. My name is Kamogelo and I am a co-registered dietitian. I have over 7 years of pediatric experience with a special interest in diabetes. So in this video, I'll be talking more about diabetes related complications, but I'll specifically focus on diabetes retinopathy. Overview of diabetic complications. Chronic exposure to elevated blood glucose leads to damage of small blood vessels and large blood vessels. Microvascular complications include diabetic retinopathy, diabetic nephropathy, and diabetic neuropathy. These complications share common underlying mechanisms including persistent hyperglycemia, oxidative stress, inflammation, and endothelial dysfunction. Amongst this, diabetic retinopathy is often asymptomatic in its early stages, which makes regular screening very essential. What is diabetic retinopathy? Diabetic retinopathy is a progressive microvascular disorder of the retina caused by prolonged hyperglycemia. High glucose levels damage the retina capillaries, which leads to increased vascular permeability, capillary occlusion, and retinal ischemia. Over time, this results in structural and functional changes in the retina, which can impair vision, and if untreated, it can lead to irreversible eye damage. Now, let's dive into the pathophysiology. The development of diabetic retinopathy is primarily driven by chronic hyperglycemia. Elevated blood glucose activates several harmful metabolic pathways, which include the polyol pathway, formation of advanced glycation end products, and the activation of protein kinase C. These processes lead to thickening of capillary basement membranes, leading to a loss of pericytes and capillary leakage and microaneurysm formation. As the disease progresses, retinal ischemia stimulates the release of vascular endothelial growth factor or VEGF. This promotes abnormal blood vessel formation. Now let's look at the classification of diabetic retinopathy. Diabetic retinopathy is classified into two main stages. The first is non-proliferative diabetic retinopathy or NPDR. This is the early stage and is characterized by microaneurysm, retinal hemorrhage, and hard exudates. Vision may still be normal at this stage. The second stage is the proliferative diabetic retinopathy or PDR. This is the advanced stage and it involves neovascularization, vitreous hemorrhage, and retinal detachment. PDR carries a significantly higher risk of severe vision loss. Risk factors. Several risk factors increase the risk of developing diabetic retinopathy. The most important modifiable risk factor include poor glycemic control, hypertension, or dyslipidemia. Non-modifiable risk factors include the duration of diabetes, type 1 diabetes with long disease duration, or pregnancy. Importantly, improving modifiable risk factors can slow the disease progression. Screening and diagnosis. Because early diabetic retinopathy is often asymptomatic, screening is critical. Guidelines recommend annual retinal screening for most adults with diabetes and earlier and more frequent screening in high-risk individuals. Diagnosis is typically made using dilated fundus examination, retinal photography, and optical coherence tomography when macular edema is suspected. Management and prevention. Managing diabetic retinopathy focuses on controlling diabetes well and treating eye damage early. Keeping blood levels within target range is the most important step. Good control of blood pressure and cholesterol helps protect the eyes. Healthy eating, guided by a registered dietitian, helps to support better blood sugar control and also reduce the risk of further eye damage. If eye changes are found, treatments may include injections into the eye to stop the abnormal blood vessels or laser treatment to prevent bleeding, or in severe cases, surgery may be considered. When diabetic retinopathy is detected early and treated promptly, serious vision loss can often be prevented. The role of multidisciplinary team. Preventing diabetic retinopathy requires a multidisciplinary approach. This includes collaboration between endocrinologists, ophthalmologists, dietitians, and diabetes nurse specialists. Dietitians play a crucial role in supporting glycemic control, cardiovascular risk reduction, and patient education, all of which directly influence retinopathy outcomes. In conclusion, diabetic retinopathy is a common but largely preventable complication of diabetes. Chronic hyperglycemia is the primary driver of disease progression, but early screening, good metabolic control, and timely treatment can preserve vision. This highlights the importance of integrated diabetes care and the role of preventative strategies in reducing long term complications. Thank you very much for listening.